All right, I've got 1 p.m., so we'll go ahead and get started. Good afternoon. My name is Casey White. I'm a Public Information Officer with the South Carolina Department of Public Health. I'd like to thank you for joining us for our weekly measles media briefing. We'll be joined by Dr. Linda Bell, state epidemiologist, who will provide us with an update on the measles outbreak in the upstate, and then take some questions. Without further ado, I will turn things over to Dr. Bell.
Thank you, Casey. Can you hear me okay?
Yep.
Thank you so much, and good afternoon, everyone. On Tuesday, the South Carolina Department of Public Health, or DPH, reported 9 new cases of measles in the state since Friday. That brings the total number of cases in South Carolina related to the upstate outbreak to 153, and the total number reported to DPH this year to 156. 5 of the new cases were household members of known cases. 2 resulted from previously reported school exposures. The source of 1 is unknown, and 1 is still under investigation. In total, there are currently 249 people in quarantine and 7 in isolation. Of our 153 outbreak-related cases, whose vaccination status is known, about 95% are unvaccinated. And this speaks to the benefit that vaccination brings as being a highly effective way to protect people against measles. Increasing our vaccination coverage could prevent ongoing spread and stop this outbreak. The MMR vaccination has been shown to provide lifelong protection for about 97% of those who complete the recommended 2-dose series. So as we continue to work to prevent community spread from occurring through public exposures, we remind people who have been notified of a potential exposure to strictly comply with DPH guidance to remain in quarantine for the time frame given. We've also previously reported that some of the public exposures have occurred in healthcare settings. So if people become ill while in quarantine, regardless of the nature of the illness, they should notify a healthcare provider of their exposure to measles before seeking care so that facilities can take measures to prevent possible exposures to others in healthcare settings. As we monitor the increase in cases, we continue to encourage people to please consider protecting their health and others. Vaccines are available at many primary care providers' offices, pharmacies, and DPH health departments. Any community partner or organization interested in scheduling a vaccination event from DPH's mobile health unit can request a visit to their location by completing the form found on our website. And with that update, Casey, I will turn it back over to you to assist with any questions that may come up. Thank you so much.
Thank you, Dr. Bell. And as most of you folks know, if you don't mind just raising your virtual hand, we'll call on you in the order that you raise your hand. And again, if you don't mind just asking one question at a time, if you have a follow-up, you can always re-raise your hand and we'll call on you. But we just want to give everyone a chance to get their questions in. And it looks like first we've got a question from Tom.
Hi, Tom Corwin, Post and Courier. So as we saw with Thanksgiving, we have a holiday coming up. Are you concerned that people may be tempted to break quarantine to go to gatherings or church or for a Christmas service?
We appreciate that we've gotten pretty good compliance with our recommendations. However, some have broken the quarantine recommendations. And so it remains a concern. Any one case that goes out in public and is potentially spreading before they recognize that they could be infected with measles remains a concern and is one of the reasons that we continue to have some of these public exposures.
Thank you.
Do we have any other questions? Caitlin? Hey, Caitlin, I'm not hearing anything on your end. Not sure if it's a mic issue. If you want to try again, or if you want to drop your question in the chat box, you're welcome to do that. In the meantime, Tom, it looks like you have another question.
Yeah, this is a little off topic, but as we just mentioned, Christmas is this week, and we're also seeing an increase in flu. Do you want to say something about people maybe trying to protect themselves?
Certainly. Um, Flu is another vaccine preventable disease. And we know that the flu activity from one season to the next is unpredictable, and how active a flu season we will have is unpredictable. Sometimes we have relatively mild seasons, and sometimes we have high levels of flu activity in our communities that overwhelm healthcare settings and healthcare providers and create additional disruption with ongoing spread in communities. Getting vaccinated against the flu is another opportunity to prevent illnesses and complications from that disease as well. Flu and measles are both transmitted by respiratory viruses very easily. Measles is much more transmissible than flu, but however, flu does spread rapidly in communities. Another reminder I want to share about flu is that people over the age of 65 and those under the age of 5 actually share an equal sort of burden of suffering from complications. Hospitalizations in those two age groups are about equal. And so we do strongly encourage people to get protection against the flu with vaccination as quickly as possible. Now that the disease is surging in our state, it takes about 2 weeks for your body to mount a full immune response to get that protection. Exposure is unpredictable. So just like we're recommending with the measles, we ask people to consider getting protected as soon as possible because you don't know when you might be exposed.
Thank you.
Yeah, thanks, Dr. Bell. And it looks like you may have answered some of Caitlin's questions there that she put in the chat box about the flu. She also asked if we have any updates about COVID-19 and is the state still tracking that at this time?
I don't have an update about COVID. We're not seeing the same level of activity with COVID, other than the only update I have is that we're not seeing the same level of activity with COVID as we are seeing with flu right now. You can refer to our website, however, to look for updated information about respiratory disease transmission in South Carolina.
Thank you, Dr. Bell. And we've got a question from Teddy Rosenbluth from the New York Times. He says, can you give an update on genetic sequencing and anything we know about how this outbreak might be connected to other outbreaks in the U.S.?
What we know about the genetic sequencing for the specimens that have been submitted from South Carolina clinical samples to that reference lab is that the genetic pattern is the same as what has been documented in other outbreak settings in the United States. That's the most commonly identified genetic pattern. It doesn't necessarily tell us a lot about the relatedness in terms of transmission from one of those other settings to South Carolina, for example, for importation directly from another location. However, it does just give us information that there is this relatedness of strains that are circulating in the United States. It's almost as if it would give us more information if there was a unique strain about an outbreak that was unrelated.
Thanks, Dr. Bell. And Baker?
Yes. Last week, I believe it was, you reported on some of the data that you've seen with vaccinations in the last couple of months. The numbers had improved or increased some. Do you have any further update on that? And even just anecdotally, your staff members or other partners on the ground in Spartanburg County, do they feel like they're making headway with vaccination rates, particularly in certain demographic, pockets in the county? If you have numbers on that, great. But again, even anecdotally, wonder just what they're seeing.
And we haven't asked other vaccine providers about their uptake. The way that we're monitoring this is by looking in our vaccination registry month to month compared to the previous year. So what we previously reported for the months of October and November showed in October an encouraging increase. In the month of November 2025 as compared to 2024, still an increase, but a bit of a slowing that was somewhat discouraging. And so we won't have that comparison for the month of December until the end of this month. And we'll take a look back and see what the December numbers look like for 2025 as compared to 2024. Aside from that, we don't have, and that really is, as providers statewide report to our registry, the best way we can look at that. So we're, other than that, we're not getting anecdotal reports or asking for that from our providers in the state.
Thanks, Dr. Bell. And we have another follow-up from Teddy from the New York Times. He asks, are you working on contract tracing to establish whether this outbreak is connected to other outbreaks? My understanding is this will become important as we consider whether the U.S. can keep its elimination status.
What our efforts are in investigating cases includes our interview of the actual cases to find out where they might have become infected, and that includes a travel history. For our contacts of cases, what we want to identify is how close in association they were with known cases. And that's where we make our recommendations for the close contacts to stay in quarantine. In terms of whether or not the country will lose its designation of having eliminated measles transmission, we're looking to the national picture for that and how they define ongoing transmission. So if there is an outbreak in one setting that has been going on for weeks or longer, but that outbreak stops, whether or not that is information that they're using as evidence of continuous ongoing transmission in the United States. And so how they're defining that is something that's currently being looked at the national level.
Baker, do you have another question?
Oh, no, I didn't. Sorry. Meant to take the thing now.
No worries. All right, Tom?
Hey, so I noticed from this update today that we have about 25 more people in quarantine, but no additional schools. So are these folks who are out in the community? And I see one of the cases, it's unknown what the contact was, and the other's being investigated. So are these primarily from the community?
Well, we have the known exposures from household contacts, and of course, school is out now. So we have identified transmission in other settings. We have not had the need to make public notifications of any for which we have not made direct contact with contacts. And so I hope I'm answering the question that you have, but with school being out, no new exposures in school settings, household transmission, and then some other settings. So the total number of people that you're looking at in quarantine is that, of course, that rolling number from previous exposures. And so I hope that's giving you the picture that you're asking for.
It does kind of, but do we know if this is going to push the date back where the people in quarantine will come out? I think it was January 8th last we checked.
Yes, it does push the date out. I think we're into the middle of January now with those currently in quarantine. The latest quarantine ending date is in the middle of January.
Okay, thank you.
Mm-hmm.
Baker?
Yeah, earlier you mentioned that there have been some cases of people stepping out of the quarantine. The recommended thing there. So do you know like how frequently that has happened? How many people that is involved, and in what way are they breaking quarantine? Are they going to the store? Are they going to church? Are they kids playing out in the yard with friends? I mean, what do we know about what's taking place there?
It varies from case to case. For the most part, we've actually had pretty good cooperation with people staying in quarantine. Some people have to break quarantine to seek medical care. Now, we don't consider that breaking quarantine. If they need care, they need care. As I mentioned earlier, we just ask them to notify healthcare settings in advance so that they can be put in an isolation room to prevent exposure to others. Some have been out in the community in various locations. We know that early on, some actually went to a public setting, into a park, in a completely open air setting where the risk of contact with others is quite low, but still we want people to be aware that when they do not observe our recommendations to remain in quarantine for the entire time that they could be incubating out, that if they go to certain settings, that could pose a risk to others. So from the small number of cases that we're aware of, there has been a variation in what those breaks in quarantine have what those scenarios are.
And do we have any other questions? Baker, is your hand up for a new question? Oh, nope. Looks like it's down now. Okay. Well, with no new questions, I think we will conclude today's briefing. We will schedule another news release to go out on Friday with an update, and then we will be back on next week. If you have any questions, feel free to reach out to us at the media mailbox. That is media@dph.sc.gov, and we can follow up with you there. Thank you for joining us, and thank you, Dr. Bell, for your time.
Thank you, everyone.